If you're over 50 and your doctor casually suggests surgery, you might be walking straight into a decision you can never undo. I'm not trying to scare you, but some of the most common procedures being recommended today, they don't always fix the problem, and in some cases, they make things worse. Today, I'm going to show you 5 surgeries I would personally never get, even if a doctor recommended them. And number 1? It shocks most of my patients. Let's be honest. When a doctor says, you need surgery, it hits differently. It feels serious, urgent, final. You trust them because you should, right? But here's the truth most people don't hear. Not every surgery is necessary. Not every procedure improves your life. And some are being recommended far more often than they should be. I've spent years working with patients over 45, people dealing with pain, circulation issues, joint stiffness, fatigue. And I've seen the same pattern again and again. People go into surgery expecting relief and come out with complications, longer recovery, or worse mobility than before. So today, I want to give you clarity. We're going to break down 5 common surgeries, ranked from the ones I'd strongly question to the one I would absolutely walk away from. But here's the key. I'm not just going to tell you what to avoid. I'm going to explain why, what's really happening inside your body, and what smarter alternatives often look like. Because once you understand that, you stop feeling powerless, and you start making decisions that protect your health long-term. Warning: the problem most people don't see. Let me ask you something. Have you ever felt cold feet or legs, even when the room isn't cold? Numbness or tingling in your hands? A strange heaviness when you walk? Fatigue that doesn't quite make sense? Most people brush this off as just aging. But it's not that simple. What's often happening inside your body is something much deeper. Your circulation is slowing down. Blood isn't flowing as efficiently as it used to. And when that happens, everything suffers. Your muscles don't get enough oxygen. Your nerves start misfiring. Your joints become stiff and inflamed. And here's where it gets dangerous. Instead of addressing the root cause, like poor circulation, inflammation, or muscle weakness, many people are fast-tracked into surgery. And that's where mistakes begin. Brain simple science, but powerful. Let's break this down in a way that actually makes sense. Your body runs on blood flow. Think of your blood vessels like highways. When they're wide open and flexible, everything moves smoothly. But as we age, those highways start to narrow. This is often due to reduced levels of something called nitric oxide. Now don't worry about the name, just remember what it does. Nitric oxide helps your blood vessels relax and expand. More nitric oxide equals better circulation. Less nitric oxide equals tighter vessels, slower blood flow, more problems. And here's the kicker. Many surgeries don't fix this underlying issue. They treat the symptom, not the cause. Which is why so many people end up saying, I had the surgery, but I still don't feel right. The 5 surgeries I would never get. We're starting with number 5, the least concerning on this list, and working our way down to the one that should make you seriously pause. Because each one gets more controversial and more misunderstood. Number 5, carpal tunnel surgery. This one surprises people. Carpal tunnel surgery is incredibly common, especially for people over 50. If you've ever had numbness in your fingers, wrist pain, or weakness when gripping things, you've probably heard about it. And yes, it can help in certain cases. But here's the problem. Most people jump to surgery way too quickly. What's actually happening? The median nerve in your wrist gets compressed. But that compression is often caused by inflammation, posture issues, or repetitive strain. Not something that automatically requires surgery. The benefit? Surgery can relieve pressure on the nerve. The downside? Recovery can take weeks or months. Grip strength may not fully return. And in some cases, symptoms come back. Not terrible, but often avoidable. What most people get wrong. They treat it like a structural problem, when it's often a functional one. And that leads to unnecessary procedures. Number 4, knee arthroscopy for arthritis. Now, this one is even more common. You go to your doctor with knee pain. They do a scan. And suddenly, surgery is on the table. Knee arthroscopy sounds simple. It's often described as cleaning up the joint. But here's what the research shows. For arthritis-related knee pain, it often doesn't work. Why? Because arthritis isn't just loose debris in your joint. It's inflammation, cartilage breakdown, muscle imbalance. Cleaning the joint doesn't fix those deeper issues. The benefit? Short-term relief in some cases. The downside? Pain often returns. You risk infection or complications, and you delay more effective treatments. This is where things start getting questionable. And here's the truth. Many people could avoid this entirely with targeted exercise, weight management, circulation support. But they're never told that. Number 3. Spinal fusion surgery. Now we're entering dangerous territory. Spinal fusion is often recommended for chronic back pain. And I understand why. Back pain is exhausting. It wears you down mentally and physically. So when someone says, "We can fix it," it's tempting. But here's what they don't always tell you. What happens in spinal fusion? 2 or more vertebrae are permanently joined together. This reduces movement in that part of your spine. Sounds good, right? Less movement, less pain? Not exactly. The problem? Your spine is designed to move. When one part stops moving, the surrounding areas take on extra stress. Over time, that can lead to new pain, new damage, and even more surgeries. The benefit? Can help in very specific cases, like instability or fractures. The downside? Long recovery, reduced mobility, high chance of needing additional procedures. This is where I start telling patients, slow down, ask more questions. Because most chronic back pain is not caused by something that needs to be fused. It's caused by weak muscles, poor posture, inflammation, circulation issues, things that can often be improved without surgery. Now, if those surprised you, the next 2 are even more controversial. These are surgeries that are still widely performed, still recommended every day. But when you really look at the evidence, you start to wonder why. And number 1? It's the one I personally would refuse, no hesitation. But before we get there, the next one is something millions of people are told they need as they age. And it might be one of the most misunderstood procedures out there. Before we dive into the top 2, let's take a second. We've already covered 3 surgeries that are often recommended too quickly. Carpal tunnel surgery, knee arthroscopy for arthritis, and spinal fusion. And if you noticed a pattern, you're absolutely right. These procedures often focus on removing, cutting, or restricting something in your body, instead of restoring what your body actually needs. Better circulation, stronger support systems, less inflammation. Now we're stepping into the final 2. And these are the ones that people rarely question. But they should. Number 2, knee replacement surgery. This one is everywhere. If you're over 55 and dealing with knee pain, chances are you've heard this. Eventually, you'll need a knee replacement. It's almost presented as inevitable. But here's what most people don't realize. A knee replacement is not a simple fix. It's a major, irreversible procedure. What actually happens? Your natural knee joint is removed and replaced with artificial components made of metal and plastic. Yes, it can reduce pain, but it comes with trade-offs most people aren't prepared for. The benefits? Pain relief in severe cases, improved function for some patients. But here's the part that concerns me. Up to 20 to 30% of patients report dissatisfaction after surgery. That's not a small number. Why? Because the knee isn't just a hinge. It's part of a complex system involving muscles, tendons, ligaments, blood flow. Replacing the joint doesn't fix those surrounding systems. The downsides? Long recovery, sometimes up to a year. Reduced range of motion, risk of infection or blood clots, and in some cases, persistent pain. Yes, there are situations where it's necessary, but far too often, it's recommended before all other options are fully explored. What most people should try first: strengthening the muscles around the knee, improving circulation, reducing inflammation through lifestyle changes. Because here's something powerful. When your muscles get stronger, they take pressure off your joints. And when circulation improves, your tissues actually heal better. Warning building to number 1. Now this is it. The one that makes me pause every time. The one I've seen people regret more than almost any other. And the scary part? It's often recommended quickly, sometimes within a single consultation. If a doctor suggested this to me, I wouldn't just hesitate. I would walk out. Number 1. Unnecessary stents for blocked arteries. This might be the most important thing you hear today, because it involves your heart, your blood flow, your life. Stents are tiny mesh tubes placed inside arteries to keep them open. And in emergency situations like a heart attack, they can absolutely save lives. No question. But here's where it gets complicated. For stable conditions, many stents are not necessary. Let that sink in. What does stable mean? You have some blockage, but you're not in immediate danger. You might feel chest discomfort, shortness of breath, fatigue. And the quick solution often presented is, let's put in a stent. Sounds logical, right? Open the artery, fix the problem. But here's what large studies have shown. In stable patients, stents often do not reduce the risk of heart attack or death compared to lifestyle changes and medication. That's huge. Why? Because the real issue isn't just one blockage. It's the overall health of your blood vessels. Inflammation, poor circulation, low nitric oxide levels. A stent doesn't fix those. The benefits? Immediate improvement in blood flow in that specific spot. The downsides? Risk of complications, bleeding from medications, false sense of being fixed, and continued progression of disease elsewhere. In non-emergency cases, this is the one I would challenge the hardest. What I would do instead, in many cases, focus on restoring blood vessel health. Because your body has an incredible ability to improve circulation if you support it properly. Light bulb, what actually works. This is the part most people miss. Now I want to give you something empowering, because it's not enough to say avoid this. You need to know what to do instead. And this is where everything connects. Remember what we talked about earlier? Nitric oxide. This tiny molecule plays a massive role in your health. When your body produces enough of it, your blood vessels relax, circulation improves, oxygen delivery increases, and suddenly, those symptoms we talked about? Cold hands and feet, fatigue, muscle weakness, they start to improve. The number 1 habit I recommend, your real treatment. If there's one thing I wish every person over 50 would start doing, it's this. Daily nitric oxide support through simple lifestyle habits. Let me break this down clearly. Step 1. Move your body daily. Even 20 to 30 minutes of walking can stimulate nitric oxide production. It doesn't have to be intense. Consistency is what matters. Step 2. Eat nitrate-rich foods. Foods like beets, spinach, arugula. These naturally boost nitric oxide levels. Step 3. Support your oral health. This might surprise you, but antibacterial mouthwash can actually reduce nitric oxide production because it kills the bacteria that help produce it. Step 4. Manage stress. Chronic stress damages your blood vessels. Simple breathing exercises can make a real difference. Step 5. Stay hydrated. Blood flow depends on proper hydration. Even mild dehydration can slow circulation. Important warning. Now I need to be very clear here. I am not saying all surgeries are bad. There are absolutely cases where surgery is necessary and life-saving. Heart attacks, severe injuries, advanced structural damage. In those situations, medical intervention is critical. But what I am saying is this. Don't rush into surgery without understanding your options. Ask questions. Get a second opinion. And most importantly, address the root cause, not just the symptom. Your body is not broken. It's responding to what it's given. And in many cases, it's asking for support, not replacement. I've seen people in their 60s and 70s completely transform their mobility, improve their circulation, and regain energy they thought was gone forever. Not through surgery, but through understanding, through small, consistent changes, through giving their body what it actually needs. And you can do the same. If you made it this far, I want to hear from you. Comment the word health below so I know you're serious about taking control of your body. And if this opened your eyes even a little, make sure you like this video and subscribe to Dr. Lainey. Because the truth is, The more you understand your body, the less likely you are to let someone else make the wrong decision for it. And that can change everything.